Okay, so I am so excited for this guest. So she is a local friend here in Utah, is a physical therapist, and specializes in pelvic health, which is not a topic we discuss a lot, especially in terms of osteoarthritis. But diving into some of the research, urinary incontinence or leaking, like say not making it to the bathroom in time, leaking when you try to stand up. There are all sorts of things that can happen with urinary incontinence, but there are actually things you can do about it. It doesn't have to be one of those things that you approach and say, this is just going to happen because I'm getting older. And so Betty is an expert in the area of pelvic health, and we are going to dive into first what urinary incontinence is, but then also what you can do to either prevent it or help it if you are currently experiencing it. So welcome, Betty. If you just want to give kind of a
Hello.
little snapshot of how you got here and how you got
Yeah.
to specialize in pelvic health, and then we'll
Yeah.
take it from there.
Awesome. So like Alyssa said, I'm Dr. Betty Delass and I specialize in pelvic health. I have been a PT for over 10 years and pelvic health is really the passion of what I do. I got into it kind of when I had kids myself and I sneezed and I peesed, which means pee your pants when you sneeze. And I was like, oh my goodness, this is not okay. I can't live like this. So really dove into it there. I have a practice called Reborn Pelvic Health and Wellness, local to Salt Lake City, Utah. And we specialize primarily in before, during, and after pregnancy, but postpartum is forever. And even if you've never had a baby, you can still have incontinence, whether you're male or female or any other gender identity there. And so it's good to know that like everyone has a pelvis and incontinence can happen for lots of different reasons. And so that's why I'm so passionate about what I do, is because it happened to me. And I don't think that people should have to just like deal with that or live with it. And so here I am.
Yes, no, I think that's super important. And I think maybe starting out with, I'm going to put you on the spot here, but if you can kind of just give maybe a brief synopsis of, it doesn't particularly have to be a specific age, but a person who maybe was experiencing urinary incontinence and how that did impact their life, but then also if they were able to kind of get on the other side of it and actually find some relief.
Yeah, absolutely. So all sorts of ranges, like the research out there on incontinence and incidence of incontinence and like aging definitely increases as we age, especially over the age of 65. It's like, I think it's in the 70s, high 70% of people have experienced incontinence. And then it's like low 30s and like the 20s and 30s year olds. So it's actually pretty high there. And I think those numbers honestly are underreported because people don't report well, or they feel shameful or embarrassed by it. So they're like, oh no, I mean, it just happened that one time. Right? Like, so those numbers are probably on the low spectrum. And so it's a very, very big issue of quality of life and like all sorts of things through that. And so a lot of times with structured rehab programs, with pelvic PT, pelvic OT, we can really help figure out the underlying root cause of why someone's leaking, whether it's, do they have a tight pelvic floor? Do they have a weak pelvic floor? Are they pressure managing inappropriately? Are they waiting too long to go to the bathroom? Are there other bladder irritants that are causing them to leak? And all sorts of different things. So we want to understand why they're leaking and then address that root problem. And then they'll be able to safely and effectively make it to the bathroom on time, or be able to sneeze and not leak and pee their pants, or get out of the chair and not pee their pants, or jump on the trampoline and not have to worry about things like that. So
yeah, and I think that especially when I was working in home care, seeing people that were probably in their like 70s, 80s, I mean, there were a lot of people who would stand up and then pee their pants or start leaking, and it just became kind of this thing that a lot of people just typically brushed off, like, oh, that's just something I have to do, or wear a pad everywhere. But really there can be, and a lot of the research is moving definitely towards more attention on pelvic health, which I think is important, because a lot of times, I mean, there wasn't a lot out there and people just think these things are normal and they're not. And so if you're experiencing any sort of leaking, say maybe you can't make it to the bathroom because of joint pain, or
Mhm.
maybe your legs just feel really heavy and stiff and so you can't get there quick enough, or maybe you wait too long, or this kind of just in case, going just in
Yes.
case. And so I want to kind of delve into some of the potential
Yes.
causes first, or some of the things that can contribute to this urinary incontinence, and then we'll kind of talk about where to go for treatments.
Certainly. So one thing, a big thing is just pressure management and breathing. So like, for instance, if you're going to go from sitting to standing, that's a very common thing all the time. And I just want to add this one piece in, is the oldest person that I've helped personally was 92. And she literally peed every time she stood out of a chair, she moved, she rolled out of bed, got out of bed, all that kind of stuff like that. She's like, I'm just leaking everywhere. And within a couple sessions with her, like we didn't do a single Kegel. I just want to say that, no Kegels, and just worked on her breathing mechanics and pressure management with that. And she was not leaking. She was like in tears because she was so happy. And she was 92. And she's like, this is
That's
life-changing
awesome.
at 92. So one of those big pieces is when you're getting out of a chair or rolling over in bed and all those things like that, is to make sure that you're exhaling. So you probably teach this in some of your exercise stuff too, of like, let's exhale on exertion. And so when you're going to stand up, really exhaling and going to pressure manage your system so that you're not bearing down or holding your breath and then causing the leaking to happen. So that's one instant tip that can help a lot of people, just breathing, exhale.
Yeah. Okay.
Yep. And then another time too is like the just in case peeing, or like urge where you're like, oh my gosh, I have to go to the bathroom and I need to get there, but you don't quite make it there in time. What you can do with that is know that there's going to be a peak of that urge, and you just need to make it to that peak. So when you have that urge coming, making sure you take a couple deep breaths, try and calm your nervous system a little bit, and then potentially either do some quick calf raises or Kegels where you're contracting your pelvic floor. Because what happens there's a reflex between your bladder and your brain. So when your bladder goes, I have to pee, and it squeezes, your pelvic floor turns off so that you can let urine out. However, if you do some calf raises or Kegels, you squeeze your pelvic floor, that signals to the brain to then signal to the bladder, oh, okay, I'll chill out. And then you don't have that strong urge. And then you can calmly and quietly walk to the bathroom and then urinate when you want to. The reason with the calf and the pelvic floor is the calf muscles are the tibial nerve and the pelvic floor is pudendal nerve, and they come off the spinal cord at the same level. So we kind of play on a little bit of a reflex arc there,
okay.
and you can do a little bit of a Kegel with the calf raise too. So I always tell people to do that together. Why not? And then it can kind of calm that bladder down so that you can make it there in time.
Interesting. And you had mentioned a couple of bladder irritants. What are some of those?
Yes, great question. So most common one that most people are pretty aware of are like caffeine in coffee and alcohol and acidic things. Those can irritate the bladder. And so just knowing that if you're going to be having those things, having increased water intake, and then also not drinking enough water. And that's very, very common. People who have to go to the bathroom a lot, they're like, oh, I'm just not going to drink water. I'm just not going to drink water. But not drinking enough water is an irritant to the bladder and can make you have to go more frequently too. So it's kind of like, you got to look at the whole picture there of like, okay, if you're having coffee, maybe have an extra glass of water, or if you're having, an acidic juice of some kind, add an extra glass of water in there, and just making sure you're hydrated well. And it's good to note too, like what's a good hydration, or how much water should I drink? And the best answer to that, because you'll see stuff all over the internet of 8 glasses of water or this many ounces per body weight. And for me as a pelvic health provider, great, it's a wonderful like tool to use, but really the best is for your own personal body to look at the toilet and see what color is your urine. And it should be a light pale yellow. If it's clear, you're overhydrated. If it's dark and it's smelly, you're underhydrated. And so you want that nice pale yellow, and then you're perfectly right where you should be.
Okay, that's very interesting. I knew that about coffee and some caffeine, but also, being in that dehydrated state, because a lot of us could probably afford to drink a lot more water than we do.
Totally.
But I hear from a lot of people that they do kind of tend to relax the amount of water that they're drinking because that they're fearful of having to get up and go to the bathroom. And with that, I know that a lot of people do have to get up in the middle of the night. And especially with osteoarthritis, you're dealing with some stiffness, you're dealing with some pain, and maybe can't move as well. And also it's dark and balance may be impaired. And so maybe what are a couple tips to kind of prevent or to maybe reduce the amount of getting up that needs to be done going to the bathroom?
Totally. So if you're under the age of 65, normal is going to the bathroom 1 or less times per night. If you're over the age of 65, normal is 2 times or less per night. So if you're going 3, 4, 5 times, it's not normal regardless of the age. And so those are things that we can train from a behavioral standpoint, and really just kind of pushing the bladder a little bit. We usually train that during the day first and then implement it at night. So if you were always going at that first urge, or you're going just in case, what you do is you shift your body's graph, so to speak, of like sense of like when your bladder's actually full, when it's not really, and you're getting the signal that it's full before it's even full, and then you're just acting on that signal, and you've trained and conditioned your body to respond to that, and so you just go and you go and you go. And so what we do is we slowly train that to go a little bit further, and a good technique for that is just simply distraction. So if you wake up in the middle of the night, you're like, oh, I can't get back to sleep till I go to the bathroom. Do you really have to go to the bathroom is the first question. And then when you go, how long is your stream? If your stream is taking 8 seconds or longer to urinate, then you probably actually really did have to go. If it's, 3 seconds, you probably really didn't. And it's more your bladder's in control of your body versus your body in control of your bladder. And so we would retrain that to just think, okay, let me roll over, distract myself, make a grocery list, count sheep, whatever that means, and then go back to sleep. So it's a totally trainable thing too, which is nice to know.
Interesting. And so essentially, not every urge means you actually have to use the bathroom.
Correct.
And I think that that's a important thing, because I mean, I feel like a lot of times, I mean, especially if you're going very frequently, just playing to those urges all the time. And the same thing with, like, if you compared it to like hunger or something, just because you feel like a pain of hunger, it doesn't always mean, I mean, you could be thirsty, you could be all bored. I think that that's really important, because acting on those urges then can help to, or then can make people reduce their intake of water, even reduce their movement, like if they're not going to the bathroom as much.
Totally.
So I think that that's really important. And if somebody is dealing with urinary incontinence, what is kind of one thing you would say to them as far as maybe getting started or finding a way to reduce it?
Yeah. So I think first off is just awareness and recognition that either it's happening and say like, yeah, this is an issue and I need to do something about it. And then just kind of taking an inventory, kind of like you take a food diary. You could do a bladder diary of like, how often am I going to the bathroom? How strong was my urge? How long was my urine stream in seconds? And then did I leak at all? And what was I doing when I was leaking? And just really making a log of that. And how much are you drinking during the day? What are you drinking? How many ounces? That's be something that we would start in the clinic just to assess. And so you could already start that now of like, okay, what's happening here? And if you're noticing, oh, my streams are, 3 seconds, 4 seconds, and there's not really long, it's like, oh, maybe I didn't really have to go. Maybe next time I'll just distract myself, or I'll go do some calf raises, or I'll go make a grocery list, and then see if I can retrain myself a little bit to space those voiding intervals out. Normal voiding time is between 2 to 4 hours. So if you're going every hour, every half hour, it's way too frequently, and that's not normal for sure. So those are just things to know, like in general, of like, oh, what's normal, and am I anywhere close to normal, is it just leaking when you're coughing, sneezing, standing, which is a little bit different of an incontinence, more of a stress incontinence we call that, versus the urge incontinence where it's like, I gotta go now and you're leaking. And you can have a mix of both too. Like those are the 3 types of incontinence there are from a urinary perspective, and as well as, we don't have to get into the bowel stuff too, but there is bowel incontinence too, but
Yes. And so I think that the important points, well, actually, let's step back for a second. As far as like when you're starting to kind of, or trying to reduce the urges, how long, and I know that this probably depends, but on average, how long do you have to kind of consciously think about it before you notice like those urges start to reduce and your body starts to become like less trained in that?
Yeah, some people, it's just even hearing this information and they're like, oh, and then it's like instantaneously they can overcome it. Some people, it takes a little bit of training, like maybe a week or 2 or 3. It just really depends on the person, of like how ingrained is this pattern, and how adaptable is their body, and what other factors and comorbidities are associated with that too. Because sometimes there's also bigger underlying pelvic floor dysfunction that's going on that we need to address as well, in conjunction with why they're leaking. So if it's as simple as like, it's just some retraining, like that could literally happen in a day or 2. But if there's some underlying things, it would take a little bit longer.
Okay, so it's essentially kind of looking at your voiding patterns and just kind of just being aware. I mean, with a lot of things, just simply
Yep.
being aware can be a really eye-opening experience, but then
Yep.
also looking at those urges,
Yep.
focusing on breathing as far as if you do notice that kind of stress incontinence. And
Mm-hmm.
even just those couple of things and being
Yep.
aware of maybe the bladder irritants, I think can start to make a big difference. And so if
Totally.
somebody is maybe trying a couple of these things and maybe isn't having luck or just would like some help, first, maybe if you could just touch briefly on how you can find someone to help you in your area, but then
Yep.
also if you want to tell us where to find you as well.
Certainly. So there's two websites that I always refer people to. It's www.pelvicrehab.com. And then you can just type in your zip code and a bunch of pelvic health therapists will pop up. And you can kind of search whoever you want there. And then the other one is www.pelvicguru.com. And both websites are great. And I would look at both of them and just kind of pick the people who are around there, read their bios. Oftentimes, a lot of us will do free 15-minute phone consultations with you to see like, what is your story? Yep. Can we help you? How will we help you? Just so you can feel comfortable in making your decision. And then me personally, locally, I'm in Salt Lake City, actually in West Jordan, and we are open here. And so you can find me on our website, www.rebornphw.com. And I'm sure Alyssa will probably put that in the show notes. And
all those links that you just mentioned down below in YouTube or on YouTube and on the podcast so that you can kind of check that out. And I think it's important because a lot of people don't really know that this exists. Like pelvic health is definitely something that's up and coming, and definitely more people are aware of it now. But definitely if you're having problems in that area, even if it's leaking or pain, a pelvic health physical therapist can be so crucial to your quality of life, because that can really impact how you move, how you exercise, and even just how you live your life. Because I've met a lot of people who don't go somewhere because they're worried about leaking or they're worried about things like that. And so I will put all of Betty's links down below. And I want to say thank you so much for joining us. I hope that this was helpful if you are listening and maybe are dealing with some urinary incontinence. Taking a look at a couple of those things that we talked about could definitely make a big change in your joint pain and just in your quality of life in general. Thank you so much.
Thanks, Alyssa. It was great having me on here.
Absolutely.